At Fiumicino Airport in Rome, they're taking no chances, for good reason. The people being monitored with heat scanners have just flown in from Wuhan, the centre of the outbreak. They left before the Chinese city was put in lockdown, but scenes like this have played out around the world. At Sydney Airport, serving Australia's largest city, many of those flying in from Wuhan on Thursday wore face masks. They knew they'd be screened, but there were no reports of illness, and they weren't overly worried.
Before we got off the plane, and a few Australian government people come to spray everywhere. And when we get off, and some people tested the fever and ask some question about your cough.
In the US, one person's known to have contracted the virus. Health officials in the state of Washington, where the man lives, say he's well and should be allowed home soon.
As of now, there are at least 16 identified close contacts. Local health departments started reaching out to them yesterday and continue to do so today.
And the list of countries with confirmed cases of the virus is getting larger, most in Eastern Asia, but some further afield.
The data that we've gathered has suggested, that this could be a very dangerous virus with potential for global spread, and even, I don't think it's being too extreme to say, even potential, for a global epidemic. But I don't think that's inevitable at this point, and the next couple of weeks will be really important to making an assessment of what the real risk is.
Still, the mere possibility means checks like this at major airports until medical experts know a lot more.
There's a whole series of questions we have to ask, and we don't have all of those answers yet. We have some of them. We know how to diagnose it. We increasingly know how to treat people when they get it. What we don't yet know is when somebody's infectious and who they pass it on to somebody else.
The next few weeks could tell us exactly how much of a threat this coronavirus poses worldwide. Nadim, Al Jazeera.